Hi, my name is Tony. I'm 78 years old, and I'm from Pittsburgh, Pennsylvania. And right now, I'm working as the board chair for NASH Knowledge, which is a nonprofit that was founded by me and my wife. I was diagnosed with liver cancer when I was 71 years old. HCC, which is shorthand for hepatocellular carcinoma, represents a large portion of all liver cancers. It affects men more than women. Some of the most common symptoms of HCC are fatigue, appetite loss, unexplained weight loss, jaundice, and there are more. It's also become one of the most deadly cancers. And so it's really something that people really need to become more familiar with. When I was first diagnosed with hepatocellular carcinoma, I really didn't know a whole lot about the disease. I've done a little research, but I knew very little about the disease. My experience is that people really don't know much about their liver, and because of that, liver disease can come up out of nowhere because often there are no symptoms. So you really need to become more educated about liver disease, the risk factors that are associated with liver disease, and discuss those with your doctor. I had cirrhosis, which turned into HCC. People most often associate HCC with being the next stage after cirrhosis. But people need to recognize, though, that you can get HCC without having cirrhosis. For example, people that have hepatitis B are at risk for cirrhosis, and there are other risk factors as well. Among the risk factors are those with type 2 diabetes, people with high blood pressure, people with cardiovascular problems, and people who are overweight. In my situation, I had non-alcoholic fatty liver disease that led to cirrhosis, and that's a very common risk factor for developing HCC. Before my diagnosis, I knew practically nothing about the risk factors that were associated with HCC. It was something that I should have known and would have liked to have known, but didn't. In my experience was that I didn't know I was at risk for cirrhosis until I had it. And it was discovered by my primary care physician after doing an ultrasound. If you're concerned about your health, or if you have any of the symptoms that we've mentioned, you really need to reach out to your healthcare provider and discuss your situation.